right now. You can find the closed caption options in your at the bottom of the screen. You also have the chat option, and you have the Q&A section. If possible, if you have specific questions that you would like the panelists or the speakers to answer, if possible, you can use the Q&A section. The chat, if you want, you can just, for instance, introduce yourself, say who you are, from which country, and which organization. I think that would be nice. But let's keep the Q&A part bottom for specific questions that you would like to ask, and we try our best. We can address some of those questions during the webinar, and I ask speakers to do that. But we can also then take some of those in the final part of the webinar. The run of show of the webinar is basically we are going to have two initial presentations by two colleagues that you can see on the screen, Josie Thum from Chavez International and Juan Castañeda from Fundación Carisma. Then we will have a panel discussion with our four experts from the Human Rights Office, Facundo Chavez, Jamele Rigolini from the World Bank. Hello, Jamele. Alex Cote from UNICEF, and Veronika, Wodsak, colleague here in the ILO. We have agreed with the four panelists three specific questions. We do 3 rounds of questions. I've asked all of them to not spend much more than 9-10 minutes between the 3 questions, so that we will then have time towards the end to get some question and answer from all the participants who want to ask questions. So I'll stop there, and Josie, the floor is yours.
Thank you so much, Stefan. If you wouldn't mind just sharing my presentation, I'll begin. So my name is Josie Thum. Welcome, everybody. I work for Privacy International, which is a London-based human rights NGO, and we are so delighted to co-deliver this webinar today. It's really brilliant to see so many people joining to discuss an issue that is often overlooked, but that affects many, many millions of people around the world. Please, Stefan, if you could move to the next slide. Thank you. The world is undergoing a seismic process of digitization, which sees the proliferation of new technologies. These rely more and more on copious amounts of personal data and on automated processes. So as part of this, there has been a growth in the rollout of digital social welfare systems, in part in response to the COVID-19 pandemic. But it is critical that the incorporation of data-driven technologies into the fabric of our societies doesn't come at the expense of fundamental rights and freedoms, particularly when those relying on social welfare systems are often part of some of the most marginalized groups within our societies. So adverse human rights impacts in this context are, of course, intersectional. They implicate a range of people from multiple marginalized groups, but I'm going to focus slightly more on people with disabilities, just because that's been my area of focus. Thank you, Stefan, if you could go, please, forwards. So the key challenges of digital social protection, the compliance with human rights and data protection principles are amongst the foremost challenges of these systems, in our opinion. The systems often process really vast amounts of personal data, and some of this data is categorized as especially sensitive data, for example, data related to your health or to a disability, and so this should be subject to increased safeguards. Now, when it comes to human rights, particularly of concern, you can see here are the right to non-discrimination and the right to privacy, which, of course, should never be sacrificed to access basic services. And the importance of complying with data protection legislation is actually specifically acknowledged, if we could just go forward, please, by the Convention on the Rights of Persons with Disabilities in Article 31. Whilst many of the member states have adopted data protection legislation, we actually are concerned that the effective implementation and enforcement of this is lacking. So a lot of this data processing activity is taking place either in a legal void or with insufficient safeguards. And please, if we could move forward again. Thank you so much. So it's necessary that states not only ensure these systems comply with international legal frameworks and, of course, their own national human rights and data protection legal frameworks, but also the core data protection principles. And I've just listed those here for your information. If we could move forward again. Thank you. I'm sorry, I'm going quite quickly. So I'm going to address the point now of automation. one aspect of the digitization of social protection systems, often we see the use of black box, artificial intelligence-powered automated decision making in making decisions to assess the eligibility for who and who cannot receive a public benefit or similar decisions. Now, we believe that states should not rely on the use of ADM in social protection programs. That's because the black box nature of this technology makes it extremely difficult to obtain transparency, accountability, and redress for these decisions. And in this context, these decisions are often life-changing. And as we all know, ADM is well reported to have that can have encoded and ableist and other discriminatory biases as well. And the EU GDPR does recognize a right also not to be subject to full ADM, so with no human intervention. But we know that even in semi-ADM, there are challenges in making sure this human intervention is meaningful. So it's not just somebody automatically approving a decision that's already been taken by a machine. And that's something that was actually recognized all the way back in 2016 by the Wisconsin Supreme Court when it sanctioned the racially discriminatory compass risk assessment system. Please, could we go to the next slide? So I'm just going to very briefly run through a couple of cases that highlight examples of where these challenges I've been talking about have manifested. Firstly, in the United Kingdom, in the wake of the CRPD committee's inquiry into the United Kingdom after benefit recipients were found to be subject to excessive surveillance, a UK government representative appeared before Parliament and said, as you can see here, that these systems actually do have biases in them, partly due to them being built on a premise or a logic that fraudsters are vying to exploit them. And where these systems do fail, these can have extremely serious consequences, even the most serious consequences. If we please go to the next slide, as highlighted, thank you, by the committee in their report this year, which discusses a host of absolutely appalling cases of benefit deaths. And the report makes some really strong recommendations, including with regards to the use of artificial intelligence and encoded biases. Another example, if we just move one forward, is from the USA, thank you, in Pittsburgh, where an algorithmic tool faced scrutiny for its biased risk assessments. So this sparked a US Justice Department investigation into potential discrimination against people with disabilities. And in one case, 2 disabled parents' baby daughter was taken into foster care after they were flagged by an automated system as being a risk to their child. So lastly, I don't have time to go into the next example, which is from Denmark, but just for anybody who's interested, please, Facundo, could we just jump forward? That was published, thank you, only this month by Amnesty International. So it's another of these examples. And if we could just go to the next slide. Thank you. So we've made a host of recommendations on this matter at Privacy International. I won't go through them all, but just to emphasize that of particular importance are the roles of governments and of international funders in conducting comprehensive and systematic due diligence, including human rights and data protection impact assessments before setting up digital social protection systems and before contracting private entities to participate in their development or delivery. And then the final slide is some further resources which might interest people on this call, including our submission, which contains these recommendations in more detail, and our new podcast on data and disability that was released last week and discusses this in greater depth with OPDs and some United Nations representatives. Looking forward to the panel discussion. Thank you so much for listening.
Thank you very much. Thank you very much, Josie. Let me then now quickly move to the second initial speaker, Juan Diego Castañeda from Fundación Carisma. Juan Diego, over to you.
Thank you so much. And thank you also for organizing the panel. I really welcome the discussion and also the opportunity to share with you a case of what Josie was just was talking about. So I am Juan Diego Castañeda, I'm co-director of Fundación Carisma, and what we do is we work as a Colombian NGO. We promote social justice and the protection of human rights in the development of policies around technology. And we are very interested in this case because we have a system here in Colombia called SISBEN. It's called the Identification System of Potential Beneficiaries of Social Programs. And since 1994, what the program does is to identify and classify people according to their poverty level through now three different data sources or data sources. One is a survey they do to people in their homes. The second one is administrative data, and the third one is a new one. It is the prediction of the capacity of income generation. So this classification is then used by programs to decide the thresholds by which they are going to decide who is going to be admitted to a program. So, for example, one program to help kids in school and give them a subsidy to attend school, it decides this classification that goes in three different categories, big categories, and then numbers inside each one. So A12, D18, that's more or less the sort of the classification they have. They use this classification to decide who can access a social program. Karisma, we have been researching this issue with the support of Privacy International. We have published a number of documents. And we have noticed we are currently deciding and working on a research project, trying to think about and see the experience of people in CISBEN. So one of the biggest issues we see here is the issue of inclusion. So what we see is that the classification is now, like, the system works by making it possible to review and potentially to cancel it, right? This review is automated, and people are usually unaware of these reviews. And the problem with that is that it has many ways to affect people and their rights. We have in the system around 34 million people. And recently, the Ombudsperson office warned about the impact of the reclassification of about 2 million people. This is because people move from the most prosperous, the best or richest, let's say, part of the classification. Sorry, the other way around. The people move from the poorest side of the classification towards the richest one. So it, as I was explaining, it implies the potential expulsion of people from this program. So they have warned that around 2 million people just at the beginning of this year, they were at risk of losing significant benefits and social programs because of this reclassification. So they have this way of working and thinking about the system ties very nicely, or sadly for the people beneficiaries of this, with what Josie was saying. These are systems that are designed through thinking that the main design goal is to reduce inclusion errors, to exclude the fraudsters. So this is how technology comes into play and data comes into play, because what they do is try to exclude as many people as possible because of different reasonings around poverty and around what is the people that deserve to be inside the poorest classifications. These are also issues that we note and we adventure this interpretation, which is a state that reads people from a long distance, and this is what technology habilitates. That is what the technology makes possible for government officials and states to have social programs that read people at a long distance through data. And in this reading and this using of data, it is where issues of autonomy and dignity, data protection, the due process come to be a part of the problem. So the human rights standards that are applicable, but many of them also, they are, one of them is active and effective participation. So to comply with these human rights standards, and particularly the ones that are set by the Inter-American Court of Human Rights, the authorities must have some sort of mechanism for active and effective participation, designing the classification system, but also understanding the classification system. In the registry, it is also necessary to ensure the participation leads to changes and reformulations in the process, and there are solutions and changes to the process effectively due to the participation of people. Other potential harms that we see is because of the infrastructural nature of these data systems. When people's classifications change in one side, they have impacts that they don't know. One of the examples that I can quickly give is just about people changing the classification, not being notified of this change, and then trying to access health services. When that happens, many people realize that their classifications was changed. And they are, because of very particular rules around the system, they are also, at that very moment, they are also liable to pay, and they are in debt with the healthcare system because of this lack of notification and the change of the system. So to propose some just key takeaways from our work and our experience on this issue in Colombia: comprehensive communication of campaigns to explain the system. The people have a lot of ideas of how the system works, and it leads them to do things that in many ways are undignified. People try to hide their TVs, people try to change their homes when the survey comes because they don't understand how the system works and they want to stay in the programs. Sufficient explanation of classifications, including data used and the sources, effective procedures to ensure compliance with data protection, and checking how much a system can impact other forms of access to services and the enjoyment of human rights. I'll leave there. Thank you so much, and I'll be happy to answer any questions.
Thank you very much, Juan Diego. I would now move on to the panel discussion. As mentioned before, we have 4 distinguished speakers with us from the Human Rights Office here in Geneva, from the colleague from the International Labour Organization, from the World Bank, and from UNICEF. So quite a nice group of entities that have something to say on this important topic. And I think both, I thank Josie and Juan Diego for the general presentation, but also for the specific example from Colombia. I think it's very indicative. And as you will see from the questions that we have previously agreed, we will start probably more with the challenges, the risks, but hopefully we'll also come up with some perhaps more positive message towards the end. But we'll definitely start first by addressing the challenges. And I'll start with you, Facundo. Can you explain us how the UN Convention on the Rights of Persons with Disabilities approaches the rights to privacy of persons with disabilities?
Thank you, Stefan, and thank you, colleagues. So we discussed this issue in our report to the Human Rights Council 4960 that mainly focused on data collection, right? And this was a report on Article 31. And we have a segment in that report where we brought together many of the standards that are applicable to this area. So just the key approaches in the CRPD. The first one is, of course, the protection of sensitive data. As was said before, the Convention highlights the need for strong safeguards against unauthorized disclosure of sensitive data, particularly health and rehabilitation information to prevent discrimination. Second point, data collection and privacy. Under Article 31, the CRPD mandates that data collection processes involving persons with disabilities comply with the right to privacy, including privacy and confidentiality standards. This way, this ensures that data collected is used only for legitimate purposes, and I want to make an emphasis on legitimate purposes, like formulating policies or without exposing individuals to harm. Then it follows the general application of data protection framework, and the Convention promotes transparent, lawful, and fair processing of data, ensuring it is used only for specific legitimate purposes. And key principles include limited and purpose-specific data collection, accuracy and protection of data integrity, and accountability for data breaches. We also look at some other items that are connected to statistical confidentiality. So data collected for statistical purposes should remain confidential and not be used for non-statistical purposes, right? So we need to focus a lot on aggregation to prevent the identification of individuals and to maintain privacy. Fifth point, inclusion in data protection laws. It's extremely important to include persons with disabilities in national data protection frameworks and ensure compliance with international privacy standards and that follow the principles that I just highlighted before. 2 more points on big data and technology. While recognizing the potential of big data to address barriers faced by persons with disabilities, the CRPD warns against the risk of biased data and discriminatory algorithms, and it advocates for transparency, accountability, and human rights-based approach in the use of big data and artificial intelligence. Finally, privacy as a framework for improvement. Privacy should not inhibit data collection, but should enhance it by ensuring that data serves human rights purposes without compromising individual rights.
Thank you, Facundo. You have looked at it from the specific disability rights perspective, which is of course the overall focus of the webinars. But of course, we are talking about an issue which also goes well beyond persons with disabilities. Veronika, what do you consider key challenges in upholding human rights and privacy in digitized social protection systems?
Yeah, I think unfortunately there are many. Some of this relate to the very nature that we're just experiencing with the digital transformation that, as Josie already said, it's quite pervasive. It's touching on every aspect of a society. And there is inevitably, I think, a time lag between the technological developments and then our regulation and legal frameworks that we establish to ensure continued accountability even with these new circumstances. And because of this complexity of the technological developments, I think there's also automatically an increased risk of producing unintended consequences. And we've seen some of these in the examples of Josie's presentations. I mean, there have really been spectacular cases also in the Netherlands, UK, Denmark, of automated processes in welfare state or welfare delivery systems without, I mean, clearly these are governments that are not known for lack of rule of law or democratic accountability. And yes, yet even there, I mean, with strong administrative capacity in these countries overall, these mishaps happened, right? Thirdly, another challenge that we're faced with is, I mean, when countries come to us to ask for technical advice on this, the main drive is typically not how can we best fulfill the human right to social security, or how can we ensure respect for the human right to privacy. The main motivation in most public administrations for introducing digital technologies is to save costs. And obviously, data privacy, data security, and respect for human rights principles in data treatment then is only perceived as cumbersome, as adding costs, as making things more complicated, and not as something that serves the primary objective of what they wanted to achieve, which is driving down costs. So I think this challenge of, I mean, in a context of rule of law and wanting to create strong, transparent, accountable institutions, we have to also be very clear about the complexities of planning for digital transformation of social protection systems, the costs that come with it. And very often, I think there's also a wrong expectation about we just can introduce a certain app to interface between citizen and government, or we can digitize paper-based systems, and then we have electronic data or databases, and that makes things easier without really looking at all the different layers that digitalization requires to really accompany this process, starting with the legal and governance structures, but also an analysis of the business processes, and the human factor, resistance to change in public administration to embrace these new technologies. It's much larger than simply introducing a new software or managing a new database. You need societal readiness. I mean, in terms of, what's of the new complexities of also educating people about their data, their rights as data subjects, and what all of this means across the public administration. And then just finally to end with, I think what we also observe with digitalization is that there is a confusion, and this is a really important challenge, between what are technical solutions and what are, I mean, expecting technical solutions to what are essentially political problems and not technical problems. And I think some of the human rights principles that are being violated are not because of the technological solutions, but because of bad design choices in social protection schemes or programs. So for people with disabilities in particular, for example, are the eligibility criteria set in a way that there is an incapacity to work requirement? This is not a technological problem, but if that's the case, then there is a potential violation there. Or are they compatible with taking up work? Are they compatible with other social protection benefits? Are there barriers for people with disability to register? So all of these are questions that are rather scheme design issues than pertaining to digitalization per se. And this brings me to the last point. Similarly, for the data collection and data privacy in poverty targeted schemes, for example, how do we design our social assistance benefit, and what is the poverty targeting mechanism that we use? If we use proxy means tests, are there 200 parameters or are there 20 parameters that we are checking for? And this speaks a lot to the data minimization principle. Josie went very quickly over that slide, but which is a pity. I think this is really important to look at these 7 principles and thinking about carefully balancing these with our objectives. And if there is a legitimate purpose, do we really need all these indicators to establish poverty or not? And what is the careful balancing of the goals that we want to reach, or can they also be reached by categorical targeting? Is there another proxy that we can use? Is the number of benefit dependents in a household another good proxy where we need far fewer indicators than a fully fledged proxy means test, etc.? So, I mean, there's a lot of complexity behind all of this, and the key challenge is how to balance these and make the right choices.
Thanks a lot. Thanks a lot, Veronika. Let me now move over to Jamele. Jamele, what do you see as the primary challenges in social protection delivery system, and why is data protection, especially for marginalized groups such as persons with disabilities, crucial as social protection increasingly relies on digital technology?
Thank you. Thank you very much. I'm going to go to the question, but I would like first to make a general point, because I was listening to the discussion. And I mean, personally, I think we should first recognize that digitalization can be good and can have a lot of positive impacts. Because when we criticize this digitalization, we should ask ourselves, what's the counterfactual? Do we want to go back to paper-based? I started working in social protection where some system were paper-based, maybe had an Excel. Believe me, they were not transparent. They had a lot of discretion, and they were extremely costly. So first, I tend to disagree with the ILO that the only reason for digitalization is to save cost. Digitalization, if well used, can increase transparency, can reduce costs, but can also help identifying people who are in need. So, and that's where I actually agree with the ILO. I would like very much to distinguish digitalization per se with the policy choices that have been made, and then use digital system. And I think indeed a lot of what we see are not necessarily bad digitalization, so that exists, but it's just policy choices that we may agree or disagree with. And even with the ILO, some policy choices we think are good, but ILO thinks are bad, or the opposite. But that's a policy discussion, is not a discussion on digitalization. And I see that to me it's important. Now, clearly, with digitalization, which I think is good, there are benefits, but there are also risks. And especially in developing countries where, you know, in a way, you cannot avoid this digitalization, but perhaps some of the governance structure is not as solid as in wealthier countries. So I think therefore, for that, our approach there is not necessarily to say, then we don't digitalize, because if you don't digitalize, you need to go back to paper-based, and it can even be worse. But it's to slowly strengthen the systems. So we actually are aware that sometimes there are issues, and that's why we need grievance redress mechanisms. We need studies that actually point out to some of these issues. I think statistical bias against the disabled is something we do need to address. It actually goes against the purpose of a system. The cisban, I think, is a more complicated situation because that's more about the targeting. It's more of a policy choice than actually perhaps about the instrument. So also the instrument itself is clearly not perfect. So I think we're moving towards the right direction. Yeah? But I would like to bring the points towards the digitalization. So as I said, we constantly strive to improve the system, improve the governance, and part of it is really the role of the social protection community, but part of it, especially on the governance side, is the role of people working on digitalization per se. I'm thinking, for instance, if you look at Namibia, there is a whole office in charge of digitalization. A lot of the issues we see are not related to social protection, are related to data privacy in general. And social protection is a user of that data privacy. So, so I think, in that sense, I think it's very important to have this discussion, to bring them down at the country level, to consult, to be sure that we don't apply algorithms with statistical bias, or if algorithms have statistical bias, we're aware of it and we actually react promptly, and we, if you have statistical bias in fraud detection, I think it's a complex issue, but you cannot let your statistical bias, affecting the ultimate goal of the challenge. So for me, it's a gradual building of systems rather than waiting that everything is perfect before implementing. Thank you.
Thank you, Jamele. Alex from UNICEF, what are, from your point of view, what are some of the drawbacks of digitization of social protection, particularly regarding privacy? And I know that going back to Jamele's point, we are still sort of more on the negative side of it, but we'll come also more to the positive side.
Thank you. Thank you very much, Stefan. And indeed, I think I agree with the last set of elements where you have to make difference between where the problem comes from digitization and when the problem comes from policy design. I think it's very important. So waiting to discuss about the positive side in a minute, few elements. And I think that what I would say in some examples, I will not give name of country, but example of what we've seen, come often from the discovery or the initial phase where we are fascinated, or the tool is there, it can solve problems, and let's go for it. And for instance, you would have a country that developed, I work more specifically on disability registries. So the leader, the president say, let's go, let's do a disability registry. There is a big announce, the system gets developed. And then years later, you realize that actually the data are with a private providers that was recruited at that time. And it has never been really transferred into the public system within proper rules and proper, and those are like, this come from the past. I think today many countries have, as Jamele said, they have entities fully dedicated to digitalization, to really look at privacy data, but you have also legacy of those first systems that sometimes are in some corners of offices, servers, and when you see those systems are not protected, which means somebody can come steal all the data. So that I think is something, the way it's done today is so much better than the way it was done 5 years or 7 years ago, but there is an element of legacy. And I think we need to be mindful of that. In the same vein, and this is not digitization per se, it's a policy choice, but in one country, in a state, within one big country, at some point, years ago, you could go on a website, enter the name of a village, and you would have all the list of the people who have a disability card, which is not necessarily what you want. You want service providers and entities providing benefit for people having a disability card, being able to verify if the card is legit. And now we have QR code, etc., which is very good. But the fact that anybody could go and click and see who has a disability card in a village it's not the case anymore. The state has changed this. But again, for me, it's like sometimes the way digitization can go fast because the technology is there if it's not done within the frame, as Jamele was saying, within those bigger entities that have all those rules set up and should frame whatever is done by the government around digitization, can end up in situations that are totally unforeseen because nobody, and the logic was we want to fight against fraud. And since we are, for instance, doing community validation of, poverty targeting, and we are making those, why not doing it with disability card? Well, because it's different and because you don't do it necessarily digitized. And there is a difference between a community meeting and something that is there forever. So I think that those are some of the elements. Another element is that what we say in accessibility is the accessibility solution for one can be the barrier for others. And if we see, for instance, many countries moving for digital registration, great. You can even think that those would be made accessible for blind people, through screen reader, because respecting the internet accessibility standard. But nevertheless, you have plenty of people with or without disability that do not have access to digital infrastructure, or even if they do not have the literacy required. And of course, many people are mindful of that. But what I have seen is sometimes, again, because the solution is there, because we can do it, and that because most people will be able to register online, then it becomes a trend. And I think connected to some of the point that was mentioned by Josie is also that digitization should support the social service workforce, not disincentivize investment in the social service workforce, but encourage, for instance, tax shifting. If you gain time on registration because there is a certain level of online registration, it means that social service workforce would have more time to reach out to most marginalized groups who do not have access to this, instead of replacing the work of social service workforce entirely in terms of registration. And again, I'm not saying that they are designed for that, but this is, if you are facing competing priorities, you have restriction in your budget, this could be temptations. So I think that those would be some of the elements I can see among others.
Thanks a lot, Alex. Let me move now back to Veronika. Veronika, what can governments do to ensure respect for human rights and privacy when embarking in the digital transformation of their services? And please, this time perhaps it can be a bit shorter than last time.
Thanks. Again, this is very complex, but the good news is that there is an interagency working group on digital social protection that has actually published guidelines on do's and don'ts. And I can just post the link in the chat if it's enabled, or in the Q&A, and then people can access the publication. They don't have to say much more, but I wanted to highlight a few things that cut across that publication. So across the board, a strong legal framework and sound governance structures are very important. There needs to be a legal basis for each processing activity related to a specific purpose. So each data transaction needs to have a legal basis, and this needs to be regulated, but it also then needs to be implemented. And we've heard already that often enforcement is a key bottleneck. This also includes establishing clear roles and responsibilities of who has which obligations and which rights. Typically countries actually establish independent supervisory authorities or data protection authorities that oversee the extent to which the rules are adhered to by the public administration. It's not enough to have that at the national level. Also at the organizational level or scheme and program level, it's important to have data protection policies that also need to be enforced throughout the delivery chain, including also if certain aspects are contracted to the private organizations or subcontracted, for example, for payment processes or for data collection. Also for the implementation, it's important that there are complaints and appeal mechanisms that are independent, easy to access, free or of low cost, and that, as I said before, people are fully aware of their rights. And this includes things like the right to data rectification, the right to data erasure, I mean, there's, together with the principle, there comes a right, a list of rights that data subjects should have. And I mean, I just wanted to respond also to Jamele to be clear. I'm not saying at all that we should abandon digitalization process. Even if we wanted to, we couldn't. But also there is a lot of potential in improving, as you said, I think making this, improving errors or reducing errors, improving accountability. The thing is, we need to get the design right and to establish the right accountability mechanisms. And because there are still a lot of unintended consequences, I also think it's super important to have NGOs help with generating that accountability. It's very valuable to have Human Rights Watch or Privacy International or Transparency International detect where there are problems and raising awareness and gathering. And this is not, I mean, this is part of the process of holding the government accountable to, even in a digital area, have the right checks and balances on all of this from my point of view. So yeah, I'm going to post the guidelines for data privacy and social protection in the chat, and hope that that will also be a helpful source for everyone.
Yes, thank you, Veronika. And yeah, just to mention that the chat should now be open for everybody. Sorry for that. It was not there from the beginning. Jamele, now over to you. We heard a lot about some of the examples that Josie and Juan Diego gave in terms of automatic social protection eligibility processes. No? So the question is around that. What are your thoughts on using digital technology to determine eligibility in social protection systems?
Thank you. Here as well, I think we need to distinguish between the technology and the use of data, which is a bit different. Like we can have a proxy means test, even paper-based. Actually, at the beginning, I think it was. But let me speak about the technology, and let me say that. Well, during COVID, I was living in a European country, and I was trying to help someone access social benefits, and you really need a PhD to register online. So I share the frustration of many people, and to me, that is where there is a lot of work to do. We cannot just erase the human interaction. It's not only about the disabled, but it's also about some people not having the skills, some people not having the awareness of things. What to me, the ideal system is, yes, we should integrate databases with privacy concern, because we need to have this overall picture of not only the person profile, but also the programs available. Integration is a good way in many cases for social workers to understand what's available. What are people eligible to access? Sometimes you would be surprised on how much this information is not there, because you have national level programs, municipal level programs, regional level programs. Some countries have more than 6,000-7,000 programs across the territory. It's fragmentation is high. So digitization is good, but to me, and some people may just be able to go and register and access the benefits, fine. But we cannot get rid of the administrative worker or the social workers, depending on what that really helps people. And that's where, to me, yeah, our work is more complex than just merging databases, because we and when we do supervision mission, we regularly see borderline cases, which it's not about the proxy mean, but it's about some rules, for instance, that make no sense, like some families where the woman needs to attend a disabled, clearly she cannot work, but then the program has a rule about work requirements. And that's about changing rules, and it's about empowering social workers to, I don't think we should empower them to bend the rules too much, because discretion can come back, but we should empower them to actually raise issues up, and then have the program being dynamic and changing the ways eligibility goes, thanks to this feedback loop. These feedback loops very often are not there. Rules are given top down, and then social workers are not necessarily empowered to raise issues, explain what's happening. So in that sense, to me, digital technology should support the work of a social worker. Maybe should also reduce the workload of a social worker, because some people may not need a human interaction. But we'll always need this proactive role of a social worker that knows who the vulnerable are and actually go and look for them, because some people may not even come to the office to register. So that's to me the sweet spot where we need to go. Yeah, thank you.
Thank you, Jamele. Over to you, Alex, but also just to mention that, because it's one of the questions asked, we are currently recording the session. It will be shared afterwards. You can also see in the chat now the document that Veronika was referring to. Alex, continuing still on the how to limit the risks, what would you like to add to that issue in terms of how to limit, let's say, the negative consequences?
I just wanted to come back to this issue of privacy, disability, social protection, because I think one of the big complaints, if we look at, for instance, disability assessment procedures, one of the big complaints that we see from many people with disability is the lack of privacy. Like, you are in a certain country, there is a mobile camp where you get registered and you have to show your impairment in front of everybody, and the doctor takes note. So I would again go back to what Veronika and Jamele said. This is not a digitization issue. This is you have a person with disability coming, I will speak with the caregiver. I will not speak with the person with disability, etc., etc. So that is embedded. The question is, does digitization help make it better, or does digitization make it worse? Like, I think Facundo mentioned, for instance, health-related data. We have been working with the Digital Convergence Initiative. There is a committee working on, and Veronika is also part of it, working on standards of exchange of information between disability management information system and social protection management information system. And we had a lot of debate about what is really needed to be exchanged. Because in one hand, as Jamele was saying, from a case management perspective, you want to have access to data to be able to match people. They have this need, I have this kind of program. The question is, how far do you go to making this information available to a social worker? For instance, when it comes to health and rehabilitation data, like, I don't know, HIV status, chronic illnesses, is it really, somebody has to draw the line of what is really needed, what is not. And I would say, again, this is not digitization. Those are really choices that have to be made, regulated ahead. And I think that the clarity that is required before you digitize. Very often I've been told, are you clear with the TOR that you give to the consultant that we develop the machine? So that's just a caricatural example. But I think in a broader way, we need to get great clarity. I give you another example. Debates about whether we should put, because we have interoperability, we should put the status of disabled people in national ID cards. You have organization of persons with disabilities that find that great. It's convenient. I don't have to carry two cards. In the other hand, many people are alarmed. You say, that if you give your ID card with your disability status, maybe a bank will discriminate you when you open a bank account, and they don't need to know that you have a disability status, for instance. So, and again, the digitization make it possible, but the choice behind this is not digitization. So I think a lot of the issues we see are not per se digital. It's just whether the digitization make it possible at a scale we've never seen before. Over.
Thank you, Alex. Facundo, how does the Human Rights Office approach the right to privacy, the right to social protection, and the right to benefit from technological advancements? And perhaps combined with that question, if you can also give a couple of country examples, perhaps.
Thank you, Stefan. I think on the right to privacy, I think I developed a little bit the standards from CRPD before. One, I would like to make an emphasis on 3 points that were discussed today. The first one is on how digitization is making an impact on human rights violations related to the right to privacy, because we cannot completely disconnect the reality of the implementation of these systems and how these systems are operating, right? So just to give an example, many countries do not have legal protections on data protection that would be up to the standards that are required for implementing a digitized system in a country, right? And they don't even have the infrastructure to manage it, right? So what they commonly do, they hire an international company, usually that has their servers abroad, right? And you have to have bilateral exchange of personal and sensitive data that will go from country A to country B, and then back from country B to country A, right? And this externalization and cross-border data management today is not up to the standards that, nor the speed or the black box or the structures that are being implemented are there, right? So use the right to privacy as a guidance and a tool to make your systems more effective while protecting the right to privacy is extremely, extremely important at this point. The second point that I also wanted to make is this idea of averaging rights, right? And this idea of, by reducing costs or increasing effects and improving the access to the right to social protection, we are not averaging rights here, right? At least not under international human rights law. This is very clear. We have three rights in this case, the ones that you mentioned: right to privacy, the right to social protection, and the right to benefit from advancements in technology, all of them reflected and undertaken in the CRPD. And in those three areas, what we need to use is this idea that Veronika brought forward, that is balancing, right? It's not about infringing one right for the benefit of the second, but really to see how our systems, as Jamele was saying, can be growing progressively to achieve the results and the objectives that they want to achieve through a process that does not create more human rights violations than before because of the speed of the management of the data, right? And the third point that I also wanted to make is decision-making processes, right? Automated decision-making in systems, it's a problem, right? It is a problem based on as many colleagues have said before, it is a problem based on the political decisions that lead to the policy design that later moves on the next step, right? Because you can apply automated decision-making in many, many, many areas that today actually are almost automated in the more non-digital world, let's say. That has to do with speeding internal processes, reducing administrative processes, and so on. But to move to the next point, let's say, in terms of making a final decision on something that it's so relevant for your human right to social protection as being eligible, like appointing, let's say, the eligibility to a given person, then that's a completely different conversation, right? So automated decision-making in that sense, it's another issue. And I want to bring also the item that Jamele also brought forward, that is decision-making on persons with disabilities. Certain populations of persons with disabilities will necessarily need that human interaction, yes or yes, right? Either because their decision-making needs peer networks to make decisions, or because they don't have the accessibility necessary to participate in the digital environment, or because the complexity of the issue, as there's a good phrase that it's in an ILO paper that looks at the sensitivity of a human interaction, that can look at what the person really needs, and in that complexity provide sincere guidance in that sense. So I think these items kind of complement this issue of the right to privacy, and that I think are important to bring to the table. The second point is on social protection. I think the benefits are huge, right? And if we look today at the access to social protection, governance, access to information, access to assistive technologies for accessing the digital environment, all of this is extremely important and relevant here. All of these are rights that are also contained in the CRPD, right? So using the right to privacy as an excuse, as Veronika was raising before, not to benefit persons with disabilities to access the right to social protection, it's a violation in itself, right? And we need to look at that very, very concretely in that sense. There are other aspects that I would like to raise that were not raised here, just to complement the issue of accessing benefits and social protection in rural areas, the extension of the access to one-stop shops. All of these, I think, are incredible potentials that today are underrating the capacity of persons with disabilities to access social protection. I think this is something that needs to be highlighted. And I agree with Jamele that many of the systems that today exist are not delivering on this point either, right? One final point on the benefits of technical advancement, or the right to benefit from technical advancements. I think there are some issues that have to do with the governance, and I want to give a couple of examples on this. And there are also some issues and solutions that come with technological solutions that can be brought into that. So I will give just two examples. One is the platform called Mi Argentina in Argentina. This platform includes disability registration for persons with disabilities. Argentina uses the ICF classification and issues one standard certification for all persons with disabilities. Right. In the past, this was a 7 months, 4-step process to reach your certification, which I have to say it's much better. Sometimes it's not about money. It's much better than many countries in Europe. And what it did was to reduce the time of getting to that certification by half. It increased the number of certificates that are issued at a completely different level, and it's also this was implemented last year, and they issued 15,500 certificates since the implementation, and the numbers are increasing. This is the last time we checked. And the other issue is the one-stop shop, right? In the past, it was 4 steps: going to the doctor, getting the appointment, etc., and now it's 1 step, right? And it's on your phone. Right, these kind of things I think are extremely important to value in that sense. Argentina also has extremely strong data protection laws, and actually last year they submitted a new regulation to go for AI-ready privacy protection and many more things that are moving in that sense. The second example that I want to give is actually from Spain. It's organized by a foundation that's called Fundación Telefónica, that has a specific team that works with a project that's called Vive Libre. And this, what this system does is to monitor movement inside your house, right? That's what it does. And of course, this raises a lot of privacy concerns, right? Extremely delicate data, and basically what it does is to monitor your pattern, let's say your behavior pattern in your house, and based on that, it would issue a green, a yellow, or red alerts that would trigger different assistance structures. Green is peer support, basically what we use a lot in disability rights, which is to inform the people that love you and are taking, are paying attention to you. That something happened, they will text you, that's it. If nothing happens, everything is okay. Second level will inform the same network and some specialized network that you can also appoint in your system. And the third one calls directly to an emergency service that is there. This has reduced, of course, human support in-house for 20,000 people in Madrid. And this is increasing the capacity of moving forward. And in terms of the privacy concern, this was sorted out in a very simple way. All the personal data remains in your place. You have sensors that are located around your house. The cost of implementing this system is extremely low for a high-income country. And of course, the data, all of your personal data, remains in your system. The system issues only the alert, right? So everything that happens in your house stays in your house, and there's no data protection breaches because there's no access to that data. Okay.
Facundo, thanks for that. These were two questions in one. We have still 15 minutes more to go, so I have one question more for Jamele, Alex, and Veronika. Please try to keep them short. Thanks also, Facundo, for addressing the issue of automated decision making, because I was feeling that this had not been addressed until now. And if Jamele, Alex, and Veronika agree, I would also like as part of your answer to the question, I would also like to hear from you. What is your viewpoint on ADM? We heard Facundo's answer to that quite clearly. Jamele, first to you. What additional measures, in your view, can be taken to ensure the inclusion of persons with disabilities in social protection systems?
Thank you. So, before going to the measures, I think we should also recognize, and that's perhaps was a bit confusing the discussion. We need to distinguish between the poverty social programs and disability policies. The two are clearly related. And in low-income countries, one criteria to include you in a standard cash transfer is to in some, not in all income countries, is for you to being disabled, and then maybe you get even a little bit of a top up. But that's an extremely simple disability policy. So that and it's great it's there, because in income countries sometimes you can't do more than that. But in middle income countries, and you really need to start distinguishing that. Like we are having many, we are having a growing number of operations where we really focus on, have a component focus on disability policies, where we help country moving from a medical assessment to a functional assessment. And then depending on the functional assessment, you give certain benefits. So I think that should be clear, because we both are social protection, but they are not always the same. Now, in both cases, I think we need to have clearly strong data privacy. I agree, and I think Alexandre mentioned a good example. It's not always crystal clear. Some people may want to be identified as disabled, some not. But we need that shows that, especially because we have gray zones, we need a lot of consultations when we do that. We need to understand from civil society organizations what they think is the way to go, and they may not even agree. I participated, and yeah. So that's the first. So and the second is, I think we need to have a push, and we're actually having it so to really start including in program design some consideration on how they can be disability inclusive. We have someone at the World Bank in our social protection unit that actually supports team to think about what it means to be disability inclusive. Unfortunately, can't be an expert of everything, and many teams are pretty good on the social and delivery system aspects, but the disability consideration requires special expertise sometimes. And we are actually having now a growing number of people who are trained with that special expertise. So I think that's beyond digitalization. But for us, keeping thriving into data privacy, consultations, grievance redress mechanism in the programs, it's something we really are working continuously on.
Thank you, Jamele. Alex, over to you. In which ways does digitization contribute to disability inclusive social protection? So we are more now on the positive side.
So I want to build on the example that Facundo gave, and it connects also to what Jamele said. Cambodia. In 3 years and a half, Cambodia has registered 1.4% of its population in a disability registry. This would never have been possible without digitization. Digitization allows for local workers from social welfare, health workers, to carry out fairly comprehensive assessments and increase reliability, because you have data in real time. You can have segregation of duty between who does the assessment and who does the verification. I'm working a lot on those things in the last few years, and this has been a game changer, literally. We are working in Sierra Leone, Zambia, and many others, and that without digitization, this would not be a conversation. So very clearly, when we think about access, identification of person with disability for the purpose of social protection, that's a great benefit. With all the questions that we tackled on privacy and who has access to information, etc., being considered. Another point is payment. For many persons with disabilities, especially those with restricted mobility, when payment is by cash in a payment point, they have to send somebody and a proxy, and it creates a whole set of problems. Digitized payments, providing that they are accessible, not everybody will be able to use them, but for many persons with disability, it's reinforcing autonomy and control over the social protection benefits that are supposed to be theirs without having to negotiate with others what would be the price of actually getting my money. So that, I think, is something very positive. Something that we are looking at, but it's really also the interoperability. Very few countries today have good setup interoperability between disability registry and other systems. This is part of why we have this work with the DCI. But for case management and policy planning, this is a new era where you can aggregate data about the number of people who need personal assistance, the number of people who would be in need of cash, the number of people who would be in need of assistive technology. Local authorities can look and plan for themselves. Rwanda is developing such a system with dashboard that local authority can use, also to work with local NGOs and development cooperation partner working at their local level. Again, paper-based, as Jamele was said, no. You would never do that because the information was not flowing like this. So I think it's like a coin. Many of the things that we said could be a risk are also an advantage. With regards to ADM, I have to say I think I would need to go back to the official UNICEF position on this. I won't be able to speak on this. But one thing that I can see, and it relates to some of the points, is that you see a lot of social service workforce doing administrative tasks, managing, basically clicking buttons, etc. Whatever can be automated within the framework of all the elements that have been mentioned before, that can save the time of those social service workforce to be able to engage in dual relationship with persons with disabilities or single mothers or anybody who actually need this dual relationship, this face-to-face engagement, I think is a gain. The problem is the risks. It like any technology, but we know that many countries are facing significant shortage of social service workforce. And digitization should not disincentivize the fact to invest in more social service workforce, but the curve between the supply and the demand is definitely not matching. So I see that as positive, very potential, very strong positive outcome of it.
Yeah, thank you, Alex. And last question to you, Veronika. What does the ILO do to support countries in the digital transformation process in the social protection context?
Yeah, so I think this maybe have become already clear from my previous interventions. I think what we're, as a standard setting organization, we try to see how our underlying principles of transparency, accountability, sound financial management, and human rights principles can now be adapted and translated into a digital area. And I mean, there was a question on this also in the chat. I mean, and this came out clearly also from our discussion. There are a lot of possibilities now with the new AI and automation, but also digitalization. But also there are a lot of questions, and it's important to then identify what questions are important to regulate. Where do we need new standards or new regulatory frameworks to ensure we can reap the benefits while mitigating risks and avoiding discrimination, exclusion, etc. So we do this by publishing guidelines like the one that I shared, by capacity building. We have a strong emphasis on capacity building, and I think this is something we haven't talked a lot about. For the implementation, this is super important across the public administration, across scheme and program implementers, but also the general public. I mean, there's a lot to be done, not just on the technical competencies and skills, but also the questions around them, so that we can ensure a human-centric approach to the new structures that we are developing. We also provide direct support to countries that are embarking in this journey of the digital transformation of their social protection systems. And we have a joint partnership with the World Bank and GIZ and others, Digital Convergence Initiative, where we address some of these questions. And I think one distinction that we haven't talked about, but that maybe is quite important and relates a bit to what Alex said. I think it's important also, we can't talk about the digitalization of social protection systems. There are back end and front end processes. And clearly on the front end, as long as it's not digital only, but digital access that is in parallel to also non-digital processes, this is clearly a tremendous asset in terms of facilitating registration, in terms of facilitating access to the services and benefits by getting electronic payments, in terms of also access to complaint and appeal mechanisms, as long as they exist in parallel to also offering human interaction possibilities. At the front end, I think this is a no-brainer that there are tremendous benefits to be had from having these digital interfaces in parallel to non-digital ones. There are privacy concerns also there in terms of information, but I think the bigger privacy concerns are more at the back-end operations. I mean, what is the data that really needs to be stored in the databases? How can we share this only on a need-to-know basis, etc. And here again, I mean, many questions I think we're still discovering. What are the questions that arise, and what are the good solutions that we can put in place while upholding human rights standards and data privacy principles.
Thanks a lot, Veronika. We're coming to an end of the webinar. It's clear that this is a topic that deserves more attention. I would therefore like to thank Josie from Privacy International who have brought this issue to us. And Josie, I would like you to say some final reflections after what you've heard from Jamele, Facundo, Alex, and Veronika. Over to you, Josie. And again, thanks for bringing this to our attention. I think it was very, very interesting webinar.
Thank you so much, Stefan, and thank you to everybody on the panel for this extremely rich discussion. It's fascinating to hear what all of you have to say. I'd just like to respond a little bit by reflecting on something that was mentioned about data sharing, which we've covered in slightly less depth, perhaps, and the increasingly relevant point of interoperability, which you raised, Alex, because these systems also raise the point of who has access to the sensitive data, how are they storing it, how are they using it, and what oversight is there. What we're seeing is there's often not enough transparency around this, and there are increasing numbers of entities, for example, many government departments, and also private actors are more and more involved in controlling and processing this data. So I just wanted to flag that point before finishing by saying I would agree with Veronika and respond to Jamele's point about digitization, that it is not about saying digitization should not happen at all, but about getting in front of the process of digitization, catching these issues early on where we see them. And I think that's why today's conversation is so important and coming at such an opportune moment, because it's important that these conversations happen in order to address some of these issues and ensure the design and the deployment of social protection is happening in a way that really upholds human rights rather than damages or harms them at all. Thank you so much. I don't know if Juan Diego wanted to comment quickly as well.
Yeah, I can just say quickly, well, thank you so much for all this discussion. I think, of course, it is not about if we should get rid of digitalization or if it's good or bad. It's more about the affordances of technology and in the idea of what it allows, right? Like without even having this intention. So not it being good or bad, tech efforts for the removal of the political discussion from social protection. That is what you see when you talk to people actually having issues with the system, and tech efforts to deepen the tools through which states decides who deserves welfare. So in this way, it engages in more potential harms to privacy, and it obscures the process by which decisions about people are made. So maybe we should go back to think more about to counter the systems that are designed to avoid inclusion errors. We need to discuss more about the universal programs. To the obscurity of the systems, we really need to engage in the design of the systems to provide them for communication of how they work, and to have really good and effective processes for people to know how their data is used, what is the data that is used to actually exercise their right to data protection, and to have some redress mechanisms that actually can change the outcome of the system. So, but thank you so much. And I think there was a really good question about how impact assessments are being used in the programs, but I don't know if there is time to answer that, but thank you so much.
Yeah, I think there's no time to answer that. But for me, this has been an appetizer for more discussion later on. Good to have seen 170 people registered. They will all get the recording of the session and the materials. And thanks again for Josie, Juan Diego, Alex, and Veronika. I think Facundo and Jamele already had to leave for this. Facundo is there. Jamele had already to leave. Thanks again for the event, and I think definitely something that will require more reflection and more collaboration between all of us in the future. All the best.
Thanks, everyone. Bye-bye.
Thank you so much. Thank you, Stefan, Veronika.
Bye. Thank you.